as we go to the close, as we draw to the close in this ceremony. We have been so busy, and tonight I thought, instead of summarizing 2 days, I will just use poetry to address the evening that is coming. Honorable ministers, Dr. Moeti, Regional Director for Africa, WHO, distinguished guests of the first Africa Health Forum, ladies and gentlemen, good evening. A historian from Burkina Faso, late Kizerbo, once spoke out in one of his speeches words that are still resounding in the halls of history. And I would like to recall them as we wrap up these 2 days that have put our mind and our hearts to contribution. Torn up between internal conflicts, wars, divisionism, tribalism, ethnicism, Africa and external dominations, Africa stands in the middle of the world as a big question mark. And if you are looking for the point, you have to look to Rhode Island, South Africa. Indeed, when you look at the world map, Africa is not less than a big question mark-shaped continent. Who is to answer such a question? From generations of our fathers and to ours today, men and women have striven to brighten a continent once called by colonizers, terra incognita ubi habitant leones, the unknown land where lions inhabit, pledging their own honor to change the wheel of fortune. Yet, we have fallen short of fulfilling the destiny of Mother Africa, the youngest and the richest continent of the world. Each single daybreak reminds us Africans that the wheel of history is still turning, that a willing generation can turn our fatalities into a dream come true and our destiny into a destination and prosperity. If you look around you, Rwanda's rebirth is a beacon of hope that life can sprout out of ashes, that the dawn we contemplate now will grow into full noon as the dividends of good governance and leadership are redistributed nationwide. The first Africa Health Forum is not ending. It just sets our way forward. Indeed, the work accomplished on these 2 days give us a preview of an Africa on the rise, the Africa we deserve, prosperous, and caring for all her own sons and daughters, longing to have them covered by an accessible and affordable health care. As we set our milestone and reach out to all stakeholders for a swift and prompt action, we also recognize how long is the way forward. Here is our call for action. Putting people first, the road to universal health coverage in Africa. Bear with me, it's long, but the work of your mind and hearts during these 48 hours. We, participants at the first ever Africa Health Forum, convened by the World Health Organization Regional Office for Africa and hosted by the government of the Republic of Rwanda from 27th to 28th June 2017 in Kigali, Republic of Rwanda, cognizant of our broad representation of the African people, leaders and policy makers, ministries of health and finance, development partners, intergovernmental agencies, the African Union Commission and the regional economic communities, the private sector, academia, philanthropic foundations, youth and women organizations, non-governmental organizations, civil society organizations, and the media. Mindful of the theme of the forum, putting people first, the road to universal health coverage in Africa, and Africa's commitment to attain the highest possible level of health for its people as articulated in the WHO Constitution, the African Union Health Strategy 2016-2030, and the Agenda 2063, and the Transformation Agenda for WHO Africa region, acknowledging the progress made in health outcomes, improved life expectancy at birth, reduction in adult mortality rate, under 5 mortality rate, and maternal mortality ratio due to better availability, coverage, and utilization of health services. Concerned that despite the progress made, inequities in service provision still persist, with a high burden of communicable diseases such as HIV, TB, malaria, and NTDs, as well as non-communicable diseases, and numerous public health emergencies that have the potential to destroy health systems and communities, disrupt national economic activities, and threaten peace and security, all against the backdrop of a demographic transformation with rapid urbanization and climate change, and limited focus on interventions that affect health but are out of the control of ministries of health. Recalling the adoption in September 2015 of the Sustainable Development Goals in general, and SDG 3 in particular, ensure healthy lives and promote well-being for all and at all ages, especially with universal health coverage, defined as all people receiving the good quality promotive, preventive, curative, rehabilitative, and palliative services they need without suffering financial hardship in so doing as one of its targets. Recognizing that the 2030 Agenda for Sustainable Development will require health system strengthening, which includes implementing the global strategy on integrated people-centered services and ensuring public health security, including better preparedness and response to disease outbreaks and epidemics and other public health emergencies. Reaffirming our commitment to putting people first, promoting synergies and coordination, and engaging all stakeholders behind the goal of achieving UHC while leaving no one behind. Hereby, commit ourselves individually and collectively to keeping UHC as the overarching approach for attaining SDG 3 in order to ensure healthy lives and promote well-being for all at all ages. Sustaining strong political will and commitment, sustaining domestic and external financial contributions and investments in health, including establishing innovative financing mechanisms, ensuring value for money and increased accountability. 3, building, reorienting, and realigning health systems towards UHC with an emphasis on primary health care and maintaining effective systems to ensure improved financial protection and affordability for the most vulnerable populations, including women, children, and the youth, while intensifying focus on quality and equity. 4, strengthening health workforce development and sustainability, including community health workers to deliver quality health services. 5, empowering people, including the youth, with the information, skills, and the resources that will enable them to actively engage in health policy development and maintain health environments, improve health literacy, thereby making effective decisions about their own health and that of their families and communities. 6th, placing stronger focus on building national core capacities for the international health regulations, including outbreak and emergency preparedness, and active engagement of communities while mobilizing strategic partners within and beyond the health sector to address the social, environmental determinants that influence vulnerability related to health emergencies. 7th, establishing well-coordinated multi-sectorial regional emergency mechanisms and teams to support countries for prompt response to outbreaks and other health emergencies, supplementing national capacities whenever needed. Eighth, strengthening advocacy and national capacity for health research, including setting the agenda, improving infrastructure, regulatory mechanisms, and human capacity for the generation, analysis, synthesis, and use of research and other health data, and mobilizing the required funding. Ninth, promoting through partnerships the use of new technologies, including innovative e-health solutions to support the attainment of UHC. 10th, establishing well-coordinated multi-sectorial monitoring and progress tracking mechanisms to promote efficiency and accountability in delivering on key health-related commitments to achieve concrete results towards attainment of UHC. 11th, creating new opportunities for improved partnerships and an enabling environment that brings together different stakeholders to undertake transformational change, including strengthening legislative frameworks, regulatory capacity, and financial management, and reorienting public policy making and the health workforce. Call upon government to provide leadership and stewardship for actions aimed at creating consultative planning platforms and regulatory frameworks for the attainment of UHC. Call upon government to increase domestic investments, mobilize and coordinate all stakeholders for a common purpose, forge partnerships with bilateral and multilateral agencies, the private sector, and civil society, and monitor and report progress. Call upon WHO to intensify its advocacy and convening role across governments, foundations, civil society, academia, and the private sector to ensure that the SDGs in general and the UHC in particular remain at the top of the political and development agenda, and that adequate domestic and external sources are mobilized. Call upon the African Union Commission to intensify its advocacy and convening role with African leaders and governments and ensure that the highest political will and commitment are mobilized and sustained for UHC and the SDGs. Call upon WHO and partners to support countries to sustain focus on accelerating efforts to address the burden of HIV, TB, malaria, and NTDs, building on the progress made in reducing maternal mortality and addressing women's health, and ensuring that resources are mobilized for health research, non-communicable diseases, and the social determinant of health. Call upon WHO and the International Telecommunication Union to support the scaling up of e-health solutions in the context of UHC and SDGs. Call upon development partners to increase their investments in UHC, including health security, and improve resource alignment to country priorities as set out by governments in line with the Paris Declaration on Aid Effectiveness. Call upon the private sector to increase its investment in health while making the most of opportunities and mechanisms such as research and development, public-private partnerships, local manufacturing of health products, direct technical assistance, and corporate social responsibilities. Call upon WHO and the African Union Commission to help strengthen the capacity of member states, facilitate and support the sharing of country experiences, and establish mechanisms for monitoring progress toward the realization of the actions as set out in this call to action. A note of thanks to His Excellency Mr. Paul Kagame, the President of the Republic of Rwanda, the government of Rwanda, and the people of Rwanda for successfully hosting the first Africa Health Forum. A request to the WHO Regional Director for Africa to extend congratulations of the Africa Health Forum to the newly elected WHO Director General, Dr. Tedros Adhanom Ghebreyesus. A request to the WHO Regional Director for Africa to present this call to action to the 68th session of the WHO Regional Committee for Africa. A request to the WHO Regional Director for Africa to establish a biennial platform to engage key stakeholders in reviewing progress towards the health-related SDGs and in identifying common strategies to expedite the achievements of UHC. Done at Kigali on 28th of June 2017. All this require a new breed of men and women lit to enlighten and inspire a new generation. As we move back to our homes and offices, actually let's commit to be that person who will invest the sweat of our daily labor to bring the call to action from paper to people. As I wrap up this first word, I would like to invite Dr. Moweti to give us her closing remarks. Thank you.
Honorable Minister of Health of Rwanda and honorable ministers from the African region, esteemed partners, distinguished guests, our youth, young people, I have to say also young-minded. What was that phrase? Young-minded elderly people like myself. As I said, I'm the oldest person in WHO Afro. Ladies and gentlemen, this call to action that's just been read to us heralds the end of a very full program and the conclusion of our first Africa Health Forum. I am thrilled, and I think collectively we have achieved what went way beyond my expectations. So I thank you so much for this wonderful output. I thank also His Excellency President Paul Kagame and the people of Rwanda for so magnificently having hosted us in this wonderful venue in this beautiful city of Kigali. I also thank, through you, Minister, the Right Honorable Prime Minister Anastase Murekezi for having honored us and opened our meeting. And I really would like to thank my sister Diane, the Minister, for having stayed with us in this meeting so consistently and for your wholehearted participation in the forum, including those dances that we held last night. I'll try to be short in my remarks because President Paul Kagame keeps his people working. The minister has to run out of here to a cabinet meeting. So we need to thank her for having stayed with us and then really going to continue her business. The call that we are adopting recognizes that the 2030 Agenda for Sustainable Development provides a unique opportunity for repositioning primary prevention in health services delivery and is also an ideal platform for catalyzing intersectoral engagement and action. And we heard a lot about that in the latter part of today. I'm immensely gratified by the commitment to stronger collaboration and engagement among all of you and all of us, the stakeholders that were here, behind the goal of achieving universal health coverage to ensure improved financial protection for the most vulnerable people in our countries and thus to leave no one behind. I said at the start of this meeting that this forum was part of the transformation agenda of WHO in the African region, which I introduced when I took office in 2015. I also said then that partnerships, results, and transparency were going to be key to the way we will be doing business in WHO in Africa to deliver on our mandate of helping to improve the health of our people. My vision really has taken a giant step to becoming a reality in this forum, which converged such a diverse participation and expert panels with lively contributions on how to promote and actually achieve health equity in Africa. I have to say again that you, all of us, have far exceeded my expectations. So in the years to come, when the young people who played such an active role here today are in the driving seat, when they are leading health in our region, when they are making research-based policy decisions, embracing partnerships and innovation, I'm asking them to think back to this forum and say, we were there with those young-minded elderly people when something started. Ladies and gentlemen, I'm happy to say that we do indeed, in responding to the call, plan to hold the forum biennially as a way of leveraging with our stakeholders and planning on how we will continue to work together to deliver the best health outcomes for the African people. So I have to say to you, you better make sure I get re-elected. Sorry, that was a joke in questionable taste. But it is very much our intention to convene us here, and we hope when we do that again, it will be a bigger group, and we will have much more participation from the other sectors about whom we spoke so much at this meeting today. A recurring theme was equity and social justice, how we can tip the scales to allow essential health and related services for all people with improved coverage and equitable access, making sure that they don't get impoverished in the process. There was general agreement that universal health coverage will bring a fairer deal for African people and contribute to reducing poverty. Time and again, the need for partnerships was underscored. I really appreciate the ministers present who participated so fully in this forum. Several of them stated boldly that health is indeed a necessity, a human right, and a contributor to socio-economic development and prosperity, and also outlined some innovations to fund healthcare in countries. We heard about some of Rwanda's homegrown solutions. We heard about financing innovations in some countries. We also were reminded that we need to be advocates for improving revenue collection in African countries, including taxation, including from those multinationals about whom so many reports are written in terms of how they could be contributing more fairly in terms of taxation. We got some very honest advice from one of our partners, one of our donors, who asked us to get the basics right, to do better with the resources that we have, and who reminded us that prevention is cheaper and better than having to treat people. As part of the transformation agenda, I'm committed to demonstrating results on our part as WHO and to using the funds that the governments and our partners provide to us efficiently and being transparent as well about what we are doing. In terms of global health security, I think we were strongly reminded by our partner that One Health is one way of demonstrating this multi-sectoral action, and we've laid the basis for it in countries. Let it show an example and deliver results. The theme of this meeting was putting people first. The road to universal health coverage includes getting the basics right at the local level. We were reminded many times. And the issue of community health workers came up as a valuable resource, and we already see how they are playing a valuable role in countries, in prevention, in surveillance, in early response to outbreaks. But it was agreed, or it was strongly recommended, that they need to be acknowledged, trained, compensated, and have clear career paths. At the start of this meeting, I also invited our young people to partner with us to create health systems that deliver for all. I was really thrilled by their enthusiasm, by how vocal they were about being involved and driving change. We hear you loud and clear, dear colleagues. You want to be sharing this driving seat. You want to be sitting at the table and not on the plate. A number of participants raised the point that to roll out universal health coverage, some kind of mandatory insurance was desirable even inevitable. So that will be one of my takeaways from here, to explore how we can help our countries make that a reality. We had a wonderful session on the role of the private sector, and I really thank those private sector partners who shared with us what you are doing and how you can do more to add to the resource envelope and to play your role in going towards, in driving us towards universal health coverage. I was really thrilled to hear about the private sector's role in providing primary health care. So you're not only aiming at high-end, sophisticated care, targeting the middle class, which you also acknowledged you were targeting. We agree that we need a mindset change. We need to build the trust. We need to change the narrative, and that we all need governments to develop the regulatory frameworks that will enable the private sector to make their contribution towards universal health coverage. So I share the belief that was expressed here that innovation, particularly information technology, is going to transform how we go about business. We were reminded that communication technology is a daily accompaniment of what we do every day in life. And nothing can illustrate that better than the way the young people who were here with us were communicating with everybody outside on this meeting. Some of our countries are making progress and innovating. I won't cite the examples. So we do have some concrete examples to inspire us as we go forward with our partner, the ITU, with whom we are hoping soon to transform our courtship into a marriage signed on dotted lines. This is coming very soon. I was also thrilled by the many digital health partners that were around at this meeting. So this provided the opportunity to get to know each other, to do some networking, and we are promising with the ITU that we will help the governments to provide the framework within which you can all work together more coherently and stop that disease that somebody called pilotitis at the side event. In closing, I'd like to pay tribute to our excellent moderators who kept us to time, sometimes very ruthlessly, but I really would like to thank them for that, and who were not shy to ask us provocative questions and to prod us until we were forced to respond honestly to issues that we feel passionate about. Thank you very much for that. To our panelists who gave of their time, who traveled from far and wide, I have to say, a very special thank you. From the ambassador who traveled from New York, to a panelist who came from India, and to all the rest of us, our colleagues who came from the US. Thank you so much for having given us your precious time, having shared your expertise, and for having committed yourselves to advising us and to working with us and our countries. We had very rich discussions at this meeting. I'd also like to thank our teams who worked so hard to organize this meeting. Yeah. Okay. So Diane, your team in the ministry that you put together, who worked so hard, and Dr. Olu, our local representative, who mobilized his team also, worked really hard. And our colleagues in the regional office, the directors who are here, and my deputy who is not here, who stayed behind to mind the house, who worked extremely hard to prepare the themes, the background documentation, and the thinking. And also to our partners who supported us in communication, and of course the members of the press who have accompanied us all the way here. So this meeting has shown us that partnership is not only critical, it's possible. And we've just taken one more step to enriching our partnerships. I've met lots of people here that I didn't know before. I've given out my card to many people, as I'm sure have all of you. And I'd like to promise you that as WHO, we will take forward this call for action, we'll transform it into a roadmap, and we'll be getting back in touch with you to hear how you are going to work with our countries to implement the actions that we have agreed on here today. Thank you very much.
Another round of applause. In Rwanda, we don't give only one round. Multiple rounds of applause for the regional director of WHO Africa. I thought the Fiona band was here to put some music between speeches, but I think she's very tired since last night. So I would like to invite again the regional director to come forward with our Minister of Health to give a farewell word before we close the ceremony, if they don't mind.
Dear Dr. Moeti, honorable ministers, distinguished guests, as we are concluding this first Africa Health Forum, let me reiterate our commitment to the call for action. This forum has been a great opportunity to discuss and find solutions if isolated we couldn't find. Let it be a solid foundation of a successful journey that will take us and our citizens to a better life we all deserve. It was a privilege of the Minister of Health to partner with WHO Afro and country office in the organization of this successful event. We sincerely hope that you had a great and productive stay in Rwanda. Your thoughts and interventions to the sessions were very instructive and highly appreciated. A special thanks to my sister, Dr. Moeti, and the Afro team for bringing this event to Rwanda. It's highly appreciated. Thank you to the WHO local team for the great partnership. Thank you to MOH, RBC, and government institutions in Rwanda for the collaboration. Thank you to the moderators and the panelists for the good discussions and for keeping time. Thank you to the band yesterday night. We enjoyed the nice music. I wish a safe trip back home to all of you, although we would like all of you to stay in Rwanda, but we know your countries need you. But we wish to see you very soon coming back to Rwanda. And for those who are staying, we are together to implement the call for action toward SDGs. Thank you very much.
Et maintenant, je suis instruit par le modérateur de déclarer clos cet forum. Merci beaucoup. Au revoir, à bientôt.
Three communiqués. Je vais le dire en français et en anglais. Le premier, c'est qu'il y a une conférence de presse après cette cérémonie dans AD10, room AD10, downstairs. Conférence de presse. There is a press conference in AD10 room downstairs. Second, those traveling from Serena, Marriott, Radisson, and Remigo, the bus transportation will be there 2 to 3 hours before your departure. If you miss the bus, you are on your own. 3, yesterday I told you that in Kinyarwanda, joy has 3 levels. there is joy which becomes happiness, happiness becomes rejoicing, and rejoicing becomes exaltation. We hope the land of 1,000 hills have rejoiced you and now have exalted you. But there is one thing we say in Kinyarwanda. There is no exaltation without a cocktail. And we hope now WHO Africa Regional is going now to say, after the closing remarks, we're going to close Radisson. No, that was just a wish list. So you are on your own. After the closing remarks, you are on your own. Enjoy Rwanda, enjoy Kigali City, go around, meet the people, visit the place you didn't go to because you were so busy, and we hope you will have a nice journey back home and a wonderful traveling. Thank you so much.